Amanda. I'm going to be your nurse today. And I'm going to be doing a head-to-toe assessment and just checking everything out. I'm going to be listening to your lungs, listening to your heart, listening to all your bowel tones, and I'll go through everything with you as we go along, okay? All right, so I'm going to do some hand hygiene here first. And I'm also going to just check the room. I don't see any trip hazards. I see that your bed is in the lower and locked position. And if I could take a look at your wristband, if you could give me your first and last name.
Michael Hale.
And your date of birth.
1/4/2000.
Wonderful. And do you know where you are?
Yep, I'm home.
And do you know what time of day it is?
Like 10:30ish.
Okay. All right, perfect. So you are alert and oriented to person, place, and time. That's great. So first things first is I'm just going to take a look at your head here. I see that everything is symmetrical. Are you experiencing any pain?
No.
And so if I were to give your pain a number between 0 to 10, 0 being nothing, 10 being the worst, where would you place it?
0.
0? Okay, great. So if you wouldn't mind just taking a look at me. First, I'm going to be checking your pupils here to see they're equal and reactive, and pupils are equal and reactive. And, oh, and then if you could also follow my pen light here, and just follow it with your eyes. Okay, great. So vision is intact. All right, so the next thing I'm going to do is I'm going to be checking different cranial nerves. So we're going to be doing a neuro check. So if you could close your eyes for me. I'm going to be checking cranial nerve number 1. If you could tell me what this is. What do you smell?
Alcohol.
Alcohol? Okay, great. And we already went through your vision check, so that means cranial nerves 2, 3, 4, and 6 are intact. So the next few things that I'm going to do are for cranial nerves 5, 7, 9, 10, and 12. It's a lot of them. But what I want you to do is look at me, and I want you to puff out your cheeks. And then don't let me, okay, great. And then if you could smile, great. And then if you could lift your eyebrows, and then if you could stick out your tongue and say ah. Okay, and all cranial nerves are intact. Now, if you could close your eyes again and tell me what side you hear something on.
Left. Right. 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 Left.
Great, so that means cranial nerve 8 is intact. Now, I'm going to push your shoulders down, and I want you to shrug. Yep, just like that. That's cranial nerve 11. Wonderful. Okay, so all the cranial nerves are intact and everything's good. Now, if you could turn your head to the side. Okay, and I don't see any distended jugulars, so to the next side. Great, so no JVD. So next thing I'm going to do is I'm going to do your cardiac and your respiratory system. So first and foremost, are you having any shortness of breath?
No.
Chest pain?
No.
Any kind of a cough?
No.
So no sputum then?
No.
Okay, great. So I'm going to palpate through here to see if there's pulsations. And I'm also going to do it across the back for crepitus. And I feel nothing. Great. So first thing I'm going to do when it comes to all the listening is I'm going to listen to 5 different points on your heart. I'm going to listen to your aortic valve, your pulmonary valve, Erb's point, tricuspid, and then your mitral valve. And then I'm going to listen to the apex of your heart for your pulse. Okay? All right. And I'm going to go aortic. Pulmonary. Erb's point. No signs of any dysrhythmias. Tricuspid. And then if you wouldn't mind me listening to the mitral. Yeah. Can I go underneath?
Yep.
Thank you. Okay, and then mitral. And I'm going to get your pulse as well. And I'm going to use the clock on the wall that is out of view. Heart rate's about 105. Are you nervous or?
I'm just eating.
Ah, that could do it. Okay, great. So I just auscultated the 5 points of your heart and got your heart rate. I already checked your, palpated your back for crepitus. There was no crepitus. Next thing I'm going to do is, your chest looks fine. I don't see any wounds, any open wounds. Also on your back, no open wounds. So I'm going to be auscultating 7 points on your front, or 6 points on the front for your lungs with 1 on each side, and then also 6 points on the back, 1 on each side, okay? And I don't need you to take deep breaths, I just need you to breathe regular. But if you could sit up straight, that would be great. Wonderful. Okay, and just continue to breathe regular. And that's point 1. Also point 1. Point 2. Also point 2, lungs are clear, all fields so far. Point 3. So far clear, also point 3. Point 4. Still clear, point 4. Still clear. 5. Still clear. 5. Still clear. 6. Still clear. 6. Still clear. And I'm going to go ahead and ask you to lift up your shirt so I can hit the bottom on the side. And just keep breathing regular. Still clear, nothing diminished. And still clear, nothing diminished. So all lung fields are clear on the front, nothing diminished. And I'm going to go ahead and start on the back and do the same thing, okay? And point 1. Point 2. That's point 1 and point 1. This is point 2. And point 2. And 3. Just following the scapula and the spine. Point 3. Point 4. Still clear. Nothing diminished. Point 4. Point 5. Clear, nothing diminished. Point 5. Clear, nothing diminished. Can I pull up your shirt here and do the bottom?
Yes.
Thank you. Point 6. Clear, nothing diminished. Point 7. Or point 6 also. Clear, nothing diminished. Point 7. And point 7. All lung fields clear with no diminished breath sounds. Great. Okay, so if you could grab my fingers here and squeeze. Great, so is equal bilateral hand grips as well as equal bilateral pulses, normal temperature and color for ethnicity, immediate cap refill bilateral. Don't see any IVs, any PICC lines or central lines that are placed, that's great. Okay, so I'm gonna move on to your digestive system. Any abdominal pain?
No.
Any nausea, vomiting, diarrhea?
No.
Normal bowel movements?
Correct.
Okay, and when was your last bowel movement?
Yesterday.
Is that normal for you?
Yeah.
Okay, great. So I don't see anything wrong that's with your GI system. I'm not gonna have you lay down, but if you could just sit up straight so I could listen to your bowel tones. And we're gonna start in the right lower quadrant. Yeah, you just ate. Yeah, bowel tones present. Bowel tones present, all 4 quadrants. And now I'm just going to, any pain when I do this?
No.
And I'm gonna check for rebound pain here. Here? No? Okay, great. Any pain with urination?
No.
Any odors, or is everything normal?
Everything's normal.
Everything's normal? Great. So with your feet here, what I'm gonna have you do is I'm gonna check everything down here, and I'm gonna have you bring your feet together like this, and give me your feet in here. Push down, great. And then put your feet down flat and push up, that's great. Everything normal, there is no signs of edema. Cap refill here. Equal bilateral pulses. equal bilateral dorsal pulses. And then if you could, I'm gonna check your balance and your gait. So if you could just take 3 steps forward and then turn around and take 3 steps back. Okay, and you're gonna see me balanced and your gait is steady. Great. I'm all done. So any questions for me?
No questions for right now.
Okay,
Thank you.
great. All right, well, again, my name's Amanda, so I'll be your nurse taking care of you today, and your call bell is in place next to you. If you need anything, just give us a call.
Awesome.
Okay, great, thank you. And hand hygiene upon exit.